I'd now like to introduce Sue Denmead, maternal child and health nurse, who will tell you a little bit about her work serving vulnerable families.
Thank you, Sue.
I haven't used one of these before, so
You're a natural, Sue.
it's a hard act to follow, I must say. I believe that I'm here to represent the workers, social workers, maternal and child health nurses, housing workers who come to the garage doors across the way there every week, whatever days they are, Wednesday, Monday, Friday, and are greeted by the volunteers and collect all the things and then take them back to our families, complex families. So it gives me great pleasure to be here this evening to speak about this charity, St Kilda Mums, which is so close to my heart and also to my chosen place of work. I would especially like to thank you amazing sponsors, organisations and private donors, as it's your collective endeavours and donations which help us to care for the babies and families in need in the heart of Melbourne, Geelong, Ballarat and the wider community. I work as an enhanced maternal and child health nurse. This means that we enhance the practice of the universal nurses. We're able to visit the more complex families more frequently than would otherwise be possible. We assist them in their homes, in playgroups, at kinder or even in the shops or coffee shop with their most basic of needs, survival. We aim to create relationships with them based on trust, hope, joy and honesty. It's challenging not to be affected by the world politics and disasters of late and to think of the impact of these devastating life-changing events on families and children around the world. But as we're also aware, we have as many social issues right here on our doorstep. There are more families living in poverty than most of us would imagine. They're not just living in Melbourne's west or north, as we might previously have thought, but right here amongst us. I work in the inner south, so not far from here, in a municipality where most people think it has a large, wealthy, comfortable and well-educated population. Whilst on one level this is true, but on the other hand, we have more and more high-rise apartment blocks, housing commission flats, transitional housing crisis, emergency housing, which cater for the rapidly growing diverse population. I have the privilege of working with quite a large number of comparatively poor, marginalised, vulnerable and often non-English speaking families who in contrast struggle on a daily basis. With the support of St Kilda Mums and the donations of a pram or a safe place to sleep for their infants, these parents feel like someone cares. A pram, a single, double, even triple, is their ticket to freedom, to get out of an often dark and poky small flat and feel like they can become part of their new community. They can visit the playground, the shops, the health centres, and they can enjoy the simple pleasure of a walk in the sunshine that we all take for granted. These people have a right to live, to give birth to babies and to enjoy their families. At a recent conference that I went to called Bridges Out of Poverty, that's compulsory training for maternal and child health nurses in Victoria, we learnt that poverty is not merely a lack of financial resources. These mostly women who we're talking about frequently experience social isolation, domestic violence, financial hardship, chaos, drug and alcohol issues. We learnt that the rules of survival are determined by the environment they have grown up in. Their decisions are made for the moment, based on their feelings and need for survival. I admire their efforts and in making the most out of their new lives and of their will to experience all the trials and tribulations of motherhood, which we all know is not easy. But they can't do this alone, and they need a bridge to climb out of their poverty. We talked to them about the efforts of all of you involved with St Kilda Mums. Their way of thinking is often shifted, ever so slightly. They realise that they too can make changes. They can help others perceived as worse off than themselves. They frequently offer to return the pram they no longer need, or the clothes or the toys their children have grown out of, many of which were originally donations from St Kilda Mums. Don't mind the podium, but anyway. Your generous donations, your mutual efforts, your support, which these mothers, fathers and children need most of all, allow us as the frontline workers to provide support in the physical sense. We've all been touched by your generosity and kindness. And the continuing tireless work of Jessie and her committee and the band of hundreds of volunteers, thousands, along with community workers, we ensure we fulfil our duty of cherishing every human life. I'd briefly like to give you an idea of how much of a difference you have made to a young Sudanese mother and her new baby. We were notified of this family by the hospital where Mum had given birth to a healthy baby girl. Mum herself has come from a very traumatic world. She actually gave birth by herself with the midwives there. No one else was there for her. Her traumatic world was in Sudan, and her parents were killed in front of her and her siblings. She was then sent with the younger cousin to a refugee camp in Egypt. I'd like to add, this story is not unusual. You've probably all heard it before, but it's a very common situation where these families come out from Egypt or otherwise. There they lived together, a couple of young, vulnerable girls. Somehow they managed to continue their educations, but their tent or home was regularly invaded by gangs of young men who tortured and abused them, often whilst they were sleeping. As a result of one of these attacks, she became pregnant. Her uncle, not really an uncle, but that's what they call them, then sponsored the girls to come to Melbourne, Australia. He has a crowded house full of young teenagers. He controls their every movement, their bank accounts, their meals, their friends, their education. So much for a better life. When I first met Mum, she was a very sad, depressed, anxious soul. She had nothing for her baby but a cardboard box and a few singlets. Living in one of the bedrooms in this flat with her cousin, who is currently studying Year 12. It's hardly ideal for either of them, any of them. We were so fortunate to have St Kilda Mums on our doorstep. The team rallied around. After a quick email to Helen and Emma, I was able to collect the goods the next day. It's done. Nearly finished.
You need that cord block.
Day, that's it. Thanks. A bassinet, a new pram, a bouncer, clothes for the baby, a bath, toiletries, some pads, breast pads for Mum, a nappy bag, nappies, wipes, etc. Thus relieving some of the enormous stress and pressures this delightful Mum was under. She then had time to concentrate on feeding her baby, caring for herself and surviving the early days of motherhood. Life continues to be challenging for this little family. Mum, due to her traumatic past, struggles to relate to her baby. Her baby, of course, picks up on this and avoids looking at her mum. The attachment between the two, which is so crucial in these early days, has been challenged. No end. Mum does try her best for her baby. She attends local play groups and Mother Goose programs, which is like a singing group for attachment issues. Now 9 months down the track, Mum and her baby clearly enjoy and trust each other so much more. It's beautiful to see her baby smiling at Mum and giggling when she sings songs to her at the group. She even has her own bank account now, and she's hoping to get a job soon and move to private rental. Small steps for sure, but one I feel privileged to be part of. She's never forgotten the generosity of St Kilda Mums and the part you all played in changing their world. In closing, I wish to thank all of you, our sponsors and donors, for your wonderful donations. It's because of you that today someone will have a safe cot to sleep in. Someone will have decent clothes or a warm coat to wear. Someone will have a pram to be taken for walks in. Someone will receive formula and nappies and sit in their high chair with their family for a meal. Someone will receive a new mother's bag of toiletries, which she could never have afforded herself. Someone will learn about the work of St Kilda Mums, and someone knows there's at least one person in this world who cares. Let's go on building the bonds of friendship and goodness through cooperation, generosity and mutual respect. Thank you all for being with us, joining us and supporting this amazing organisation.